2022 HINTS dataset.
Hello. Hi, everyone. It's loud. Hi, my name is Dayanna Ramirez. I am a second-year PhD student at the Rollins School of Public Health in the Department of Behavioral and Social and Health Education Sciences. And today I'm going to share the findings of a study where we explore the predictors of genetic testing completion for hereditary cancer risk among U.S. Latinos. So, why genetic testing even matters, right? Cancer is the leading cause of death among the US Latino population, accounting for 20% of annual deaths in this community. And although not all of these deaths are associated with hereditary cancers, we know that Latinos have a higher prevalence of pathogenic variants. One study found that Latina women were the most likely out of any group to have a pathogenic variant for breast cancer. And a separate study also found that Latinos as a whole were more likely to have pathogenic variants for early onset colorectal cancer. Despite this, though, we see that genetic testing disparities persist in this community. A community health study among Latinos found that 40% reported being aware of genetic testing for disease risk, but of those 40%, only 5% were offered genetic testing by healthcare providers, and less than 3% completed a genetic test for for disease risk screening in general, leaving over 51% of Latinos to continue to still be unaware of genetic testing for disease risk. So this really highlights that there is a huge gap in the engagement we have towards the Latino community. And this is a great way to, beginning with awareness, we can really do more to address issues of health equity in terms of early disease risk screening. So we were seeking to answer the question, what constructs outlined by the health belief model predict completion of genetic testing for disease screening among Latinos? And we chose the health belief model because it is one of the most cited models throughout public health. It informs various interventions and measurements in public health. And it is a model that explains or tries to predict using constructs, right, the health behaviors of on an individual level. So for our study, we used the National Health Information, the Health Information National Trends Survey, also known as the HINTS 6 survey. It was the 2022 wave. That was the most recent data. In this sample, there were 940 Latinos who responded that they were aware of genetic testing. So this was our study sample. And to analyze the predictiveness of the health belief model constructs, we went through the whole survey and looked for questions that measured such constructs. For example, perceived severity is one of these constructs. And for this construct, we looked at the question, when I think about cancer, I think about death. So your alignment with this question, if it was greater, right, you would have a greater perceived severity of cancer. For statistical analyses, we ran multiple logistic regressions and bivariate analyses to examine if these health belief model constructs predict completion of genetic testing. So if you've seen the health belief model, there's a lot of constructs. So there were various models. And after controlling for covariates, we found that nothing in the health belief model actually predicted this health behavior among Latinos. None of the demographic variables listed, psychological characteristics such as frustration, perceived barriers or facilitators, even health efficacy, right? Like that just did not predict anything. And there may be some reasons for that. Despite this model being very well studied, it still reflects a Western individualistic perspective on health behavior. And that is an important piece of the puzzle, but it is a piece of the puzzle. There's still more to understand in terms of health behaviors. It emphasizes individual responsibility and decision making rather than community or collective influences. And we know that, especially in Latino communities, collectiveness natures of family orientations are really important. So we also know that this model has limited cultural sensitivity. It doesn't account for social, cultural, or structural contexts that shape our health behaviors and facilitate certain actions. So For future directions, we need to explore predictors that capture the interpersonal influences, community factors, systems, and interactions between these levels. And I've included some possible directions down here, and I have seen some papers do this already, so I think we're headed there, which is great. For our team personally, we recently submitted a diversity supplement where we propose exploring the role of acculturation in preventative health behaviors with the goal of developing a theory-informed and community-adapted acculturation measurement tool. We're specifically interested in measuring acculturation because we know that the Latino community is not only growing, but its profile is changing. And we need to understand what that change looks like to better equip ourselves to meet the needs of this community. Thank you.
Questions or suggestions for Dayanna?